Hi, my name is Doug, and if you're watching this video, you are probably suffering from BPH like I was, and you're looking for answers on what type of treatments are available for people who suffer with BPH. And I'm making this video to go over my thought process on how I came to the conclusion to have a TURP procedure completed. A little bit of background. It is June 2nd, 2021. A little bit of history about me. I'm 60 years old right now. And before I really get into the way I came to the conclusion to have a TURP, let me just give you a little disclaimer. I am not a doctor. I am not a nurse. I'm not in the medical field at all. So please consult a licensed physician, a nurse, or someone in the medical field who can answer your questions as far as these procedures more thoroughly than I can. I do have some notes over here, so if I glance down, please forgive me. A little history about myself again. About 2 years ago, I noticed that I started having some issues, the typical BPH symptoms of getting up 2-3 times a night to go to the bathroom, always feeling like my bladder was not totally empty. I would go to the bathroom, zip up and leave, and all of a sudden get that sudden urge that, oops, there's some more in there, and I'd have to go back to the bathroom. Again, the typical issues associated with BPH. I went to my primary care physician a couple years ago, and he did a PSA test on me. My PSA at that time was 5.2, which is elevated. My primary care did a digital exam on me, said that he could tell that my prostate was enlarged. However, he did not feel any bumps or lesions, so he said he really wasn't too concerned about it, but he wanted to keep an eye on it. So about a year went by, went back for another physical, and he did another PSA test, and again, it was still around 5. It was definitely over 5, but not too high. And at that point, he recommended that I should go consult a urologist. And I live about 20 minutes south of St. Louis, Missouri in the United States, and I contacted Urology of St. Louis, a wonderful medical group consisting of approximately 10 doctors and many nurses and technicians, fantastic people. The doctor that I talked to, his name is William Critchlow, very nice guy, listened to me. That was very important, is that he listened to everything that I had to say. He gave me plenty of options, and that assisted me with making my decision to do the TURP procedure. So one of the things that, the first thing that he told me was, well, we can do nothing, because he had looked at my test results from my primary care, and he said, well, you know, 5 is not good, but it doesn't mean that I had cancer or anything like that. He said that he thought it would be a good idea to have some more testing done, which I did. I had another PSA done, and it was still at a 5. So he said, well, we can do nothing and just let it go. He said, you know, if I did have cancer, generally it grows very slow, and most men outlive it, the cancer that they have. He said another option was Flomax. And he recommended that I at least try the Flomax to see if it worked. No guarantee that it would do any good. So I started doing some research on Flomax. He put me on Flomax, and pretty much everything that I saw about Flomax was, yes, it does work. It takes about a week for it to kick in, but generally after some period of time, Flomax stops working. I was on it for about 6 weeks, and I was doing really well with it. After about 6 weeks, I kind of noticed the same symptoms were coming back, of having to get up in the middle of the night and go multiple times again and having that full bladder feeling. So I was taking the 0.4, and I contacted my doctor and I said, can I double it, which is either 0.4 or 0.8 are generally the recommended dosages. So I went up to the 0.8, took that for another month, and it did no good. And so I contacted my doctor, Critchlow, again, and he said, yeah, that's kind of fast that my body rejected the Flomax. But he said, well, come on in and we'll talk about other things that can be done as far as surgery. So I started doing research. What's out there? Obviously on YouTube, the internet, there's so many videos out there discussing the various types of procedures that you can go through. The first one I want to talk about is the Urolift. Watched a lot of videos about Urolift. The doctors that were showing Urolift, they all said the same thing. It is a good procedure. It's a safe procedure. Your downtime is just a few hours generally because you're not under general anesthesia. It's just more like a local anesthesia, maybe a spinal block, things like that. I recommend that you get on the internet, look at some of these Urolift procedures. Basically what it does is they insert like plastic double-ended T's through the wall of the prostate, and it just pulls the prostate apart. So your ureter is open so you can go to the bathroom more. Some of the doctors did mention that if your prostate continues to grow, they may have to go back in at some point and cut the old double-ended T's out and reinsert newer ones, because again, if your prostate continues to grow, it can get blocked in other locations. One doctor that I did watch, he even mentioned generally if that occurs on his patients, he will remove those double-ended T's and he will recommend a TURP procedure. So the Urolift, again, low downtime, it does work. A member of my family had it done and he raves about it. So again, do your research. The other one that I found was Resume, and if you have not seen the Resume procedure, that basically is the doctor will put a kind of like a pencil size piece of equipment up inside, and it has a little bit of a hook to it, and it injects really superheated steam into prostate tissue, and it basically causes that tissue to shrink up a little bit. And it's a little bit more invasive. Again, you're not under general anesthesia. It takes maybe 10-15 minutes to have that procedure completed. Again, the doctors say they have a good healing rate with that, good response with that, but again, some of these doctors were saying, again, there's a possibility that your tissue could continue to grow, and maybe we need to do the TURP procedure. So again, talk to your doctor, do your research. That's the most important thing, is do your research, get an idea. There are other options out there that I'm not going to go into, but the technology is constantly changing. So how did I come up with deciding to go with the TURP procedure? Well, like I said, I'm 60 years old. My wife is 61 at this point. We are done having kids. I also know from the TURP procedure that, and again, some doctors will give you different numbers. Some doctors give you like a 20% chance of a retrograde ejaculation. And again, look that up. There are videos about retrograde ejaculation, which is basically a dry ejaculation. The ejaculate goes into the bladder, and then when you go to the bathroom, the semen is removed that way. Other doctors, like my doctor, he told me, yeah, there's probably about a 100% chance that I am going to have a retrograde ejaculation. And like I said, at 60 years old, we're not going to have any more kids, and not to sound gross, but we've all had the wet sheet effect and other things that I'm not going to go into. If you're married, have sex, you know what I'm talking about. So to me, a retrograde ejaculation really was not anything to be concerned with. As a matter of fact, as I said when I was on the Flomax, I experienced the retrograde ejaculation, and it was really nothing. I still had the enjoyment that we all look for, and it was dry. So I was actually kind of excited about that. Some people may think I'm crazy, but if you're a young man still wanting to have children, TURP may not be the way you want to go because of the retrograde ejaculation. I'm going to try to make another video. Now, I'm 1 week out at this point from my TURP procedure. So I'm going to try to make another video and talk about the procedure itself and, more importantly, the recovery time. So look for that video if I put it out. So the TURP procedure, the big drawback to the TURP procedure, and there's several of them, you will be under general anesthesia. It takes about 60 minutes to 90 minutes to do it. My procedure took about 45 minutes for my TURP procedure. Been off work for a week now, and you have to go on, you have to spend the night in the hospital. You will be on a catheter. You will be draining for 4 or 5 days, blood and clots and things like that. Like I said, I'll get more into that in this other video. But the main reason why I went with the TURP procedure is some of the videos that I watched, most of the doctors said it is still considered the gold standard. I believe it was first introduced in 1926, and that's pretty much been the gold standard for BPH and enlarged prostate. And I figured, at this point in my life, let's just get it done. Like I said, with the other procedures, the doctor said there's a possibility that you may have to have a TURP, and I thought, well, let's just get it done, get it over with. Why have multiple procedures and then come back to the end all of procedures, which is the TURP? So I really just thought, like I said, I'm 60 years old, done having kids. I'm not afraid of the retrograde ejaculation, and one and done. I'll take the time off from work and the other side effects that go with it. And, hopefully in another week or two, I'll be, a normal person going to the bathroom, emptying my bladder totally. As I said, I'm 1 week out from my surgery. I did go in yesterday and had my first follow-up at the doctor's office. They did a sonogram of my bladder, and they said there was no fluid left in my bladder. It was totally empty, which when I went back, or when I was there several months prior to surgery, after I went to the bathroom at that location, I still had 17 milliliters left in my bladder, which really wasn't a lot according to them, but I was still retaining fluid. And like I said, yesterday, totally empty. The lady who did the sonogram said, I can't find any fluid anywhere inside the bladder because I'm emptying it. There's no obstructions. Most of the tissue inside of my prostate has been removed thanks to the doctor and the TURP procedure. So again, do your research, find out what best fits you. Above all else, talk to your family. I spoke many times to my wife about the variety of procedures out there. Talk to your doctor. My doctor, like I said, Dr. Critchlow, great guy. He recommended any of these, and I said, Doc, I want to do the TURP. Let's get it over with. And he said, okay, let's do it. So a week later, I was in surgery, and here I am making this video. But above all else, it's your decision. Do what best fits you. Don't let any doctor talk you into a procedure. If you're not satisfied with your doctor, find somebody else. There are plenty of doctors around who will do this, and they will talk to you. But like I said, you have the final say. And if you have to be kind of forceful and say, Doc, this is what I want, like I did, if they say, well, let's do this other procedure, get up and walk out. It's your body. Do with it as you see fit. So that's kind of some of the things that I looked at as far as the other procedures and what was going on in my life. I still work full-time, and I'm glad I made the decision. And like I said, I'm going to try to put together another video of the actual procedure and the recovery, and hopefully that'll answer some questions you may have about the recovery and some of the things that they did not tell me about the recovery that I wish I knew before then. I'm still all for the TURP for me, but I wish they would have told me, look for this, and you may want to do this. So look for that video. I appreciate your time. I wish all the men out there that have BPH, if you're getting any of these procedures, I wish you the best. And thanks for watching, and take care. Bye.